The last thing 19-year-old Evan Brooks said before he stepped into the shower was, "Mom, I'm fine. I just need hot water to sleep better." But his mother, Dana, stood frozen in the doorway of their small apartment bathroom, watching her son's silhouette slump forward as he gripped the sink. Something in the way he moved wasn't right. His hands shook, his breaths were shallow, and when he looked up at her, his pupils seemed blown wide like he'd just come out of a panic attack. "You didn't sleep again?" she asked. He didn't answer, just rubbed his sternum like something inside was flickering, misfiring. Irritable, pale, sweating. She'd seen this before, but only once, when her younger brother died at 25. But she never talks about that. The bathroom filled with steam. Evan stepped into the shower, closing the curtain, his silhouette blurred behind the fog glass. Down the hall, Dr. Leela Chen, the ER physician, who lived next door, heard the thud, a wet, heavy sound. Too heavy for an object, too sharp for a fall, a body. She ran. Dana's scream cracked the hallway open. They found Evan crumpled on the shower floor, water beating down on his pale skin. His eyes half open, fixed, his body twitching in odd, rapid jolts, not like a seizure. Something different. "Call 911. Dr. Chen yelled as she knelt beside him, checking his carotid pulse, fluttering, erratic, like it was trying to escape his neck. His lips were turning blue. "Evan, can you hear me?" she whispered. A faint exhale, a broken attempt at a sentence. "I feel fire." Then nothing. The paramedics arrived fast, too fast, as if they already knew something terrible was happening in that building. One of them, paramedic Josh, looked at the rhythm on the monitor, and his face drained of color. "Dr. Chen, this is weird. The ECG's trying to form a pattern, but it's slipping." "What pattern?" she asked. He didn't answer. The monitor beeped louder, then louder, then fly. Evan's heart had stopped. They shocked him once, twice, a third time. Nothing. As they carried him out of the apartment, Dr. Chen noticed his chest. No trauma, no bruises, no obvious cause, just a faint, temporary wave-like pattern in his ECG strip as the stretcher disappeared down the stairs. Something she had only seen in textbooks. Something rare, something lethal, something inherited. A chill moved up her back. "Dana," she whispered, "did anyone in your family ever die suddenly, young, and without explanation?" Dana froze. Her silence was the cliffhanger. Her eyes said everything, and nothing at all. The hospital room was too quiet for a sudden death case. Too still, too expectant. Dr. Chen stood at the foot of the bed where Evan's lifeless body rested under a white sheet. Dana sat beside him, gripping his cold hand as if she could anchor him back into the world. "I need to ask again," Dr. Chen said gently. "Any family history of fainting, collapse, sudden cardiac death?" Dana swallowed hard, her eyes red. "My younger brother died in the shower when he was 25. They called it cardiac arrest, no cause." Dr. Chen exhaled slowly. She had been afraid of that answer. She reviewed the ECG strip again. The brief pattern right before the line flattened. A strange elevation in the right precordial leads. A cup shape, a fingerprint left by a heart wired wrong. Not a heart attack, not dehydration, not drugs. Something else? She ordered an urgent electrophysiology review. When the cardiologist, Dr. Marcus Hale, arrived, he stared at the strip and turned pale. "Where's the rest of the ECG?" he asked. "That's all we captured before he crashed," Dr. Chen replied. He shook his head. "No, Leela, this morphology, this looks like a type 1 Brugada pattern, but it's incomplete." Dana looked between them. "What does that mean?" Dr. Chen took a breath. "It's a rare disorder. Electrical. Heart looks normal structurally, but the wiring misfires. It can trigger sudden arrhythmias, especially with fever, stress, or heat." "Heat," Dana whispered. "Like a hot shower." Dr. Hale nodded. "Exactly." A silence dropped like a weight, but then came another contradiction. The autopsy reported no structural heart disease, no blockages, no toxins, nothing. Just one line scribbled by the medical examiner. "Suspicious for channelopathy. Recommend genetic analysis." Channelopathy, a disorder of the ion channels. Invisible, deadly, inherited. Dana wrapped her arms around herself, as if an old memory was curling back up her spine. "My mother?" she whispered. She used to sleep sitting up, said lying flat made her heart skip. I thought it was anxiety. Dr. Chen's throat tightened. This wasn't one tragedy. This was a pattern, a family tree with missing branches. The deeper they went, the darker it grew. When the preliminary genetic screen returned, Dr. Hale read one word aloud. SEN5A mutation? Dana's breath caught. Dr. Chen closed her eyes. That mutation was almost diagnostic for Brugada Syndrome, a silent, hereditary electrical disorder, one that kills without warning, one that hides until heat, stress, or sleep unmasked it. But the final confirmation required the autopsy's microscopic analysis. When the lab called, Dr. Chen answered. She listened. Her face changed. Her hand shook. She hung up. Dana stood. What did they find? Dr. Chen looked at her with a mix of fear and sorrow. Something in the tissue that shouldn't be there. A pattern that confirms the electrical instability. What pattern? Dana whispered. Dr. Chen hesitated. Fibrosis, subtle, patchy, in the same region seen in lethal Brugada cases. Dana collapsed into a chair, sobbing into her hands. But the horror wasn't over. The genetic counselor walked in. We need to test you, she told Dana quietly. Tonight. Dana looked up, trembling. Why, I'm fine. No, Dr. Chen said softly. You're not? The results came back at 3:14 a.m. Dana stood alone in the consultation room, hugging herself as Dr. Chen entered with an envelope she wished she didn't have to open. She sat down. Dana, you carry the same SCN5A mutation? Dana's knees buckled. No, I'd never fainted. I've never. That's how Brugada works, Dr. Chen said quietly. Some people show symptoms. Some never do. But the risk is always there, passed silently from parent to child, like a shadow. Dana covered her mouth. I gave this to him. Her voice cracked in half. It's not your fault, Dr. Chen whispered. Most people never know they have it. It hides in the DNA, waiting for the right trigger. Dana collapsed into a chair. She couldn't breathe. Dr. Chen explained gently. Brugada Syndrome is an electrical disorder. The heart looks normal, but the sodium channels, the ones that help it beat, malfunction. Sometimes it causes fainting, sometimes nighttime death, sometimes collapsing after heat exposure. Dana whispered. The shower. The hot water increased his body temperature. It unmasked the arrhythmia, and when the rhythm collapsed into ventricular fibrillation, she paused. It was too fast, too chaotic to reverse. A long, horrifying silence. Then Dana asked the question no parent wants to ask. Can I die the same way? Dr. Chen nodded slowly. But now you know, and you can be protected. An ICD, an implantable defibrillator, can stop a fatal rhythm. You still have time. Dana cried harder, not from fear, from the realization that her son never had that chance. She looked at the envelope, at her son's name on his autopsy report. Did he know? She whispered. Did he ever feel it coming? Dr. Chen hesitated. Then she pulled out the final photograph taken in DR, the one that would go in the medical record. Evan's chest was bare, and there, faint but visible, was the same wave-like saint elevation she'd seen before, a Brugada pattern, like a ghost signature, a hereditary warning written across his heart, one that he never understood. Dana pressed her forehead to the picture, sobbing. Dr. Chen placed a hand on her shoulder. These patterns, they pass through generations, unseen, silent, but now the silence is broken. The final line of the autopsy read, cause of death, sudden rhythmic event consistent with Brugada syndrome, manner, natural, hereditary. Dana closed her eyes. The story of her son's death didn't end with him. It began with her. And the last chilling realization was this. Her family tree wasn't cursed. It was wired wrong. And no one ever knew. Until now.